Today's presentation will be on the history of osteopathy. Our presenter is Peter B. Wagner, Doctor of Osteopathy, Clinical Associate Professor, East Carolina Heart Institute. He's the son of an osteopathic physician. He grew up in Huntington Valley, Pennsylvania, worked as an EMS for 19 years, attended Temple University, the medical school at the Philadelphia College of Osteopathic Medicine, and he did an osteopathic rotating internship at Metropolitan Hospital in Philadelphia, a medicine residency at the Hospital of the Philadelphia Osteopathic College of Medicine, and at the St. Agnes Medical Center in Philadelphia also. He did his cardiology fellowship at the Deborah Heart and Lung Institute in New Jersey. He joined us in Greenville 16 years ago, and his interests include scuba diving and dive medicine, so we're hoping to grab him for a talk sometime in the future on dive medicine.
I'm not a medical historian, I am just a clinician. But when they asked me to do this talk, and I assume I was probably the last person they asked, probably asked a dozen people before me. I had an interest in this topic. We studied this certainly in medical school, and so it has some fascination for me. And I figured since North Carolina is fairly osteopathic ignorant, I could probably say anything I want about osteopathy and get away with it. So do we have any other DOs here in the group? Okay, so I'm pretty safe to say just about anything. I claim to be a third generation DO, sort of. My great uncle Ed was a member of the PCO class of 1926. In those days they called it the Philadelphia College of Osteopathy. He went on to be faculty there in dermatology and histology. My father, E. Noble Wagner, class of 1955, and every time I was complaining about what they paid us as interns, he would always remind me that when he was an intern they made $50 a month and they were darn glad to get it. So those were the good old days. And then I graduated in 1989. Osteopathic medicine, I often say, is the best kept secret in America. I sort of learned that when I first came to Greenville, having come from Philadelphia, which is a osteopathic rich environment. Lots of DOs in the Philadelphia area. And coming to North Carolina, I think in my first month, I had a patient just look at me and says, "What's a DO?" Well, and that sort of took me back. And I think once a week I got that question for quite a while, and I finally had to come up with the Reader's Digest version on what's a DO. So hopefully at the end of this talk we'll have shared a little information about what a DO is and what it means. Anyway, osteopathy was born on the frontier. Andrew Taylor Still was the founder of osteopathy. He was an MD, and he was quite an interesting fellow. We're going to talk a little bit about him because that's where it all started. He was a physician, an author, an inventor, a politician. He was sort of a Renaissance man for in frontier style. Born in 1828, died in 1917. And just to give you a little flavor of the frontier in those days, Andrew Taylor Still's great-grandfather was killed by a Shawnee War party in July 14th of 1786. And if you think about the timeline there, 1786, he was born in 1828. We're talking about 35 years roughly. It's like saying your grandmother was killed by an Indian War party back in the 70s. A lot of things were happening there on the frontier. His great-grandmother was captured, tortured, and burned at the stake. They dragged her out of their cabin, dragged her to Detroit from western Virginia, killed several of her children along the way in a very brutal fashion, and apparently they didn't like the fact that she was lamenting over the loss of her children, and they decided to torture and burn her at the stake. Fortunately, while several of her children were killed, two survived, Mary and James, and they suffered considerable hardship living with the Shawnee Indians, and later were sold to French traders, and over a period of 3 years returned to Virginia, kind of an arduous journey. So these were tough people. James Moore was A.T. Still's maternal grandfather. He married 3 times. His wife, Patsy Pogue, was the mother of Martha Moore. Just kind of trying to connect some dots here. Martha Moore later married Dr. Abram Still, who was, and she was Dr. A.T. Still's mother. Dr. Abram Still A.T. Still's father, was born in Buncombe County in North Carolina. I guess that's Asheville area, 1797. So we can tie North Carolina into this. And he initially moved out to Tennessee and became, he was a physician trained by his father. In those days, most physicians out in the frontier were trained as apprentices. It was usually passed down through the family. He was ordained as a preacher in the Holston Conference of the Methodist Church. He was a fire and brimstone sort of guy, so he had quite a presence. He eventually married Martha Moore, and they later moved back to Virginia and then traveled around because of his ministry. He ended up in Missouri and then later in Kansas. He had an interesting connection to William Ganaway Parson Brownlow's family. He was his family physician. If you recall, he was the governor of Tennessee and a U.S. senator after the Civil War, and quite an interesting character as well. You might want to take some time and read about him. He was quite outspoken and was an anti-slave individual at a time when there was great controversy about slavery in Tennessee. And his policies after the Civil War were quite interesting, fairly totalitarian, but he had a lot to do with the Reconstruction in Tennessee at that time. Consequently, Abram Still became an ardent abolitionist as well, and this concept influenced A.T. Still later in his life. Anyway, Abram and Martha had 4 sons in the medical profession, and one daughter was the wife of a physician, and one daughter who was the wife of a preacher. I guess you had a choice of being a preacher or a physician in those days, and many times you were both. Andrew was born in Lee County, Virginia in 1828. He grew up on a farm, and thinking back on what farm life was in the 1830s, probably got up at the crack of dawn, probably had to drive a mule team to plow the fields, probably worked for several hours before, had breakfast, then went off to school, and then came home and had multiple chores to do after school. I don't think my kids could do that. I don't know about yours. He attended several formal schools, but he often stated that his frontier experience was valuable to me in more ways than I can ever tell. I had almost perfected knowledge from the great book of nature. Being on the frontier, he was one with the environment. He was an avid hunter. He would go out and, as part of feeding the family, they had to go and hunt. And he wouldn't just dress down the deer. He would dissect the deer and study the bones and the muscles. And so he used that as an opportunity to understand the environment. In 1849, he married Mary Vaughan. They had 3 children. 2 of them died young. And Mary died in 1859. And this is a fairly devastating blow to Still. It took him a while to get over this. But he then remarried in 1860 to Mary Turner. I guess he had a thing for Marys. They had a bunch of kids. I'm trying to figure out how many they had, but I think at one point he had 9 or 10 kids between his 2 marriages. He remained married to Mary for about 50 years. Mary Turner once remarked she would never marry a doctor, a preacher, or a widower, and with Still she got all 3. So he initially was trained as an apprentice. Later, after the Civil War, he attended the College of Physicians and Surgeons in Kansas City. So his early training was as an apprentice from his father, and he was an intense student of anatomy, both from textbooks and from nature. As I mentioned, he would look at these animals that he would capture and very carefully. And he seemed to have a kind of a stubborn streak in him. There was a story where his father was riding down the road, coming back to the farm in his horse and buggy, and there was Andrew sitting on the side of the road, facing away from the road, and his father, reading an anatomy textbook, and his father scolded him and says, "You know, I don't allow people to read my anatomy books in the field." And he just turned himself around and put his feet in the road. I guess that was his way of saying, well, I'm not in the field now, I'm in the road. So, feisty kid. The Jacksonian era was a time that encouraged independent thought and the development of new disciplines to improve the lot of mankind. There were a lot of alternative medical fields coming out in this time, chiropractic medicine, homeopathy. A time where everybody was looking for a better way to do things. In between 1852 and 3, he was a scout surgeon under General John C. Fremont. He got a lot of experience doing surgery there. And then when he left the service, he served in the legislature in Kansas, 1857 to 58. This was a time of great turmoil, a lot of issues about slavery. He, of course, being an abolitionist at heart, was wrapped up in that controversy. There was a story where he was, and he was well known for this, and he was also trying to practice medicine. He was traveling around throughout the area, treating folks in their homes, and he used to try to find the roads that were safe roads, because there were a lot of marauders running around attacking people on the road, and he was going along on his horse, and he came across a group of soldiers who were pro-slave soldiers, and instead of trying to run, he kind of confronted them and says, you know, what the heck are you doing here? Well, he didn't say heck, and the captain said, well, what the heck are you doing here? And he says, well, I'm going to drill your soldiers, make sure they know what they're doing. And the captain said, okay, fine, knowing right well that they were enemies. And so he got out there and he tried to drill these soldiers, and they were tripping over each other and all this, because he had a military background. And in the end, the captain turned to his soldiers and says, you know, we may differ in our politics, but if Dr. Still is traveling, you're to let him pass, because he saved my wife from cholera. So he was well known in the area, both for his politics and for his medical skill. He had a lot to do with the founding of Baker University in 1858. Still and his family were fairly successful financially, and they had some land that they donated to start Baker University. Baker University is a four-year college, a Methodist college in Kansas. It's the oldest four-year college in Kansas, still in operation. So he had a lot to do with the building of that university. He actually went out and bought a sawmill and learned how to saw wood, and spent part of his day sawing wood to help build the university, part of his day tending to his farm, and part of his day practicing medicine. During the Civil War, he served as a surgeon. I think he originally was not thought of as a surgeon, but his surgical skill was noted, and he was turned into a surgeon. He rose to the rank of major, and he suffered some injuries. I tried to find more references about what happened, but it's a little nebulous about what injuries he suffered. But at one point, he tried to get some money back from the military from his pension, but they claimed that he was in a militia. So back in those days, I guess the government tried not to pay medical claims for their veterans. During his time in the military, he started to lose faith in mainstream medicine. He faced epidemics of cholera, malaria, pneumonia, smallpox, diphtheria, tuberculosis. But the medications at the time were quite crude, at best, often harmful. They used arsenic, castor oil, whiskey, opium. Medications contained mercury. Pretty harsh stuff. Many of the injuries that he treated in the military were treated with amputation because they had nothing else to do. Infection was poorly understood. They had a routine use of bloodletting, emesis, sedation with narcotics, and only maggots, chloroform, and ether for anesthesia, and opiates for pain seemed to have any effectiveness. Casualty figures from his Kansas regiments reflected the national medical crisis. 1,000 soldiers were killed in battle. 2,100 men died of disease. In the Union Army, 286 surgeons died. 231 of those died of disease. Following the war, Still lost 3 children to spinal meningitis in a very short period of time. Later, 1 died of pneumonia. All of that occurred in 1 year. He had lost his wife in 1959, now lost 4 children in a very short period of time. And he stood by and he just felt very ineffective. As a physician, there was nothing he could do to save his children. He believed that the conventional medical system at the time just was totally ineffective. It was morally corrupt. It just wasn't adequate to handle any of this. This is an interesting quote. I began to see during the Civil War in that part of the states of Missouri and Kansas where the doctors were shut out, the children did not die. So he developed a belief that everything that was necessary to sustain human life was already present within the human body. The body has an innate ability to heal itself. And he was looking for non-medicinal or surgical ways to enhance that ability. He came up with the name osteopathy by blending 2 Greek roots, osteon for bone and pathos for suffering. And if we go back to Hippocrates, even Hippocrates said, it is our natures that are the physicians of our disease. So he recognized that we have the innate ability to heal ourselves. Sir William Osler, famous physician, medicine should begin with the patient, continue with the patient, and end with the patient. And one of the first duties of the physician is to educate the masses not to take medicine. Still was mechanically minded. He held several patents. I'm not sure, one was a butter churn. I'm not sure that constitutes a major breakthrough in the Industrial Revolution, but he looked at the body as a highly complex machine which, like any other machine, required proper alignment and lubrication for optimal functioning. So if the components are working properly, then the machine should work well. He focused on removing these mechanical blockages to the free flow of blood, lymphatic fluid, central cerebral spinal fluid, nerve impulses. And this was the key to the body's self-regulation. He first proposed all of this in 1874. To find health should be the object of the doctor. Anyone can find disease. Another quote from the great man, my father was a progressive farmer and was always ready to lay aside an old plow if he could replace it with one better constructed for its work. All through life, I have ever been ready to buy a better plow, always looking for a better way to do something. During the war, he suffered some injuries, as I mentioned, and this incapacitated him for many months, and he had time to think about these concepts. And he finally regained his strength, and he set out to practice his osteopathic medicine. Traveled mostly in Missouri and Kansas. And he gained significant popularity and loyalty to the point where he finally had to settle in Kirksville, Missouri, and he just was seeing so many people, he had to stop traveling, and people started coming to him. So he established an infirmary there and was quite successful. The railroad even scheduled additional trains to handle the increased volume. At the end of the 18th century, there was, as I mentioned, there were multiple schools of healing. We had chiropractic medicine, homeopathy, naturopathy. There was a lot of competition between these elements. And a lot of mistrust of new ideas. There's probably a lot of charlatans running around, people promoting things, snake oil, and it was really hard, probably for a lot of people who are uneducated, to determine what was real and what was not real. Of course, this was frontier medicine, not big city medicine. So, Kansas of the late 1800s was way out there, and to try to promote these concepts in the big medical centers of the East was just very difficult. So these concepts were just very limited in its acceptance in the East. The first school of osteopathy was started by Still in 1892 there in Kirksville. He called it the American School of Osteopathy, and that school still is in existence at the Kirksville College of Osteopathic Medicine. His first class had 21 students, both men and women. He didn't discriminate. Three of his sons and one of his daughters attended the school. His faculty consisted of two, himself and William Smith. William Smith, interesting guy, he was a medical doctor trained at the Royal College of Physicians and Surgeons at Edinburgh, Scotland. I guess he was out working for a book company selling textbooks, and he was calling on physicians in that area. And he kept hearing these stories about this old quack who was hurting their business. His patients were doing well. They'd go to him and they'd get healed, and go to these other guys and they weren't getting healed. Just quackery is a derogatory term. It's not something to be thrown around lightly. So if you call a physician a quack, that's a pretty heinous thing to call him. When told about these patients that were actually being cured, Dr. Smith was intrigued. So he sought out Still, and they had a conference. They sat down, they talked for hours, and Still agreed to teach him about osteopathy if Smith would stay and teach anatomy at the school. So, and he became the first graduate of the American School of Osteopathy. Here's a picture of the two having a smoke. How appropriate. This is the first school. It was a 16 by 22 foot frame building. Not much to look at. And this is the first class. There's some controversy about how many people were actually in the class. Most think there were 21. The school's original charter, which came from the state of Kansas, gave them the right to confer the Doctor of Medicine degree, but the school's governing body chose instead to offer the Diplomat of Osteopathy, or DO degree. They wanted to really distance themselves from mainstream medicine at the time because they felt there was something different to what they had to offer. They awarded 18 diplomas in March of 1894. Still originally started teaching in 1891, and he thought he could teach his techniques in a 3-month program. And he quickly found that people didn't catch on so fast. So while he trained a bunch of people in that 3-month program, gave them some kind of certificate, he offered them to stay and learn it properly, and most of his first class was made up of those early attendees. Many of his students then went on and started their own schools of osteopathy, and they sprung up very quickly. In January of 1897, the school had grown to occupy 30,000 square feet in a 4-story building. It had 14 faculty, and they were teaching 280 students from 24 states, 2 Canadian provinces. They also had some of the latest equipment that was available at the time, including early X-ray machines. In 1897, the students got together and they formed the American Association for the Advancement of Osteopathy, which later became the American Osteopathic Association. They were very keen on making sure that quality was a thrust in this, and they wanted to make sure that they did everything right. So having standards and a committee on education was very important. Daniel B. McCauley was the first president of the association. I just want to read this because I think it's kind of interesting. The reasons for the organization are many, are obvious, are strong, and the personal protection is the least of these. No, the members of this organization have laid upon them a heavier responsibility, a greater duty than the so-called first law of nature, self-preservation. The primary objects of the organization are, in the broadest sense, to work toward and attain all things that will truly tend to be the advancement of osteopathy, and the rounding of it into its destined proportions as the eternal truth and vital principle of therapeutic science. It was clear that these folks had a passion for this. They felt that this is very important science that they were uncovering here. In 1898, several schools had opened, and an association of colleges had to be formed to set standards of curriculum, length of study, make sure everybody's working from the same book. In 1903, they even established the process of inspection, so they go out to campuses and inspect to make sure that they're meeting these standards. Well, along with this, as I mentioned, this is not well received by mainstream medicine. Osteopathy was repressed, It developed in the frontier, not in the ivory towers of medicine in the East. The theories were not well received. In the first half of the 20th century, the AMA even labeled osteopathy as a cult and osteopaths as cultists. I was, tell you an anecdote, when I was running ambulance calls back in I guess it was the late 70s, a friend of mine was in osteopathic school. He was driving the ambulance, I was in the back, and we were transporting a critical patient from University of Pennsylvania to somewhere else. And in the back of the ambulance was a medical resident from the University of Pennsylvania. And we were just chatting, and she was relatively attractive young woman, and I kind of struck up a conversation. I asked her what she knew about osteopathy. And the first thing out of her mouth, oh, that's a cult. We didn't talk much after that. Anyway, so that's the late 70s. Anyway, even Baker University, which is the college that A.T. Still helped found, restricted him. He tried to come there and give a lecture series on osteopathy, and they refused to let him in. Federal government also did not recognize osteopathy in those days. Interesting sidebar, Mark Twain was actually a proponent of osteopathic medicine. And he equipped to ask a doctor's opinion of osteopathy is equivalent to going to Satan for information about Christianity. Interestingly enough, manipulative treatments helped alleviate symptoms of his daughter's epilepsy and his own chronic bronchitis. And one of my other favorite Mark Twain quotes is, quitting smoking is easy, I've done it 100 times. In the 1920s and 1930s, the AOA was really pushing for recognition. And just as an example, these are the kind of things that were going on. In 1935, the U.S. Employees Compensation Commission strictly defined a physician as a holder of an MD degree. Well, so here were osteopathic physicians who held licenses in many states to practice full medicine being excluded from that. And they essentially had to go to court, and finally in 1938 that compensation law was amended to include DOs as physicians. And this was sort of a running theme throughout the first half of the 20th century. Then something very interesting happened in California. The California Medical Practice Act passed in 1907, and that defined physicians in the state. In 1919, the composite board that was created from this act refused to examine DOs and forced them to establish a separate board of examiners. And then in 1961, the two organizations, the California Medical Association and California Osteopathic Association, got together. They signed a contract, and they took the College of Osteopathic Physicians and Surgeons in Los Angeles, and they converted it to an allopathic institution, now offering an MD diploma, essentially trying to oust osteopaths from California. Well, the new school issued MD degrees, and DOs could trade in their DO degrees for MD degrees if they attended a short 12-week Saturday sessions and paid $65. And that at the time was felt to be quite a blow to the profession, because 85% of the DOs took advantage of that. In 1962, Proposition 22 was passed, and that essentially abolished the Osteopathic Licensing Board. So no new osteopathic physicians could be licensed in the state of California. Unfortunately, the MD degrees were not recognized outside the state. So, if you liked California, didn't want to go someplace else, you were stuck. Unfortunately, this backfired. It turned into a catalyst for obtaining full licensure in all 50 states. They looked at the curriculum for this school, and the curriculum didn't change when it went from osteopathic to allopathic. And the osteopathic folks at the time said, hey, if it's the same curriculum, why are you barring osteopathic physicians there? And it was a great argument. And it essentially showed that osteopathic medical training was equivalent to allopathic medical training. In 1973, all 50 states and the District of Columbia granted DOs full practice rights. At the same time, the AOA and the osteopathic physicians in California that remained worked to overturn Proposition 22 in 1974. It was declared unconstitutional by the California Supreme Court, and a new osteopathic board was established. And in 1977, the College of Osteopathic Medicine of the Pacific was opened. So osteopathy regained a foothold in California at that time. Federal recognition was very important for osteopathic medicine, and the U.S. Department of Health, Education, and Welfare finally recognized the AOA in 1952. In 1967, the AOA was recognized by the National Commission on Accrediting and now became known as the accrediting body for all osteopathic institutions. And this had a profound effect on the growth of osteopathic medicine. Another generation of osteopathic schools started to open up, and through the late 70s and 80s, we saw a number of osteopathic schools opening, and osteopathic applications to medical schools increased dramatically. And then the big shift came when we saw state-supported schools opening. Michigan State University College of Osteopathic Medicine was the first. Ohio, Texas, off the top of my head, those are the three that come to mind. These are big schools. Military service was a little bit different. In 1941, FDR signed the Military Appropriations Act and supposedly gained recognition of DOs in the nation's military service. Unfortunately, for a long time, DOs could only practice as corpsmen and not physicians in the military. And that had sort of a backfire thing, because the osteopathic physicians stayed home and took care of everybody at home while the MDs were off to war. So, somebody had to practice medicine back home. But during the mid-1950s, it triggered a series of subcommittee hearings, and finally DOs were eligible for military commissions. Public service, health service first accepted DOs, gave them the equivalent of military rank, but it wasn't until 1966 that DOs were accepted as physicians in the military. Today, DOs serve in all branches of the military. Lieutenant General Ronald Blank, now retired, was the former Surgeon General of the Army. He was the #1 physician in the Army not too many years ago. So I think there was a DO who was an admiral, and so you see DOs throughout the military now. People often ask, so what is this thing that's osteopathy? What is different about osteopathy? And I guess I'm going to try to summarize the osteopathic philosophy. Structure and function are closely related. Can't separate one from the other. Form determines function. Function determines form. Health emerges when form and function are perfectly expressed. So every body part connects to every other body part. If one body part is diseased or out of alignment or dysfunctional, then it's going to affect all body parts. No single part exists independent of the whole. Even when a small part of the body dysfunctions, the entire organism is affected. There is within each of us an inherent wisdom, a wise, all-knowing restorative force, an intelligence within every cell that keeps the body well. When a state of discord arises, this healing force acts to restore functional balance and harmony. And my favorite is, the rule of the artery is supreme. When blood and lymphatics flow freely, the tissues can perform their physiologic functions without impedance. So how do we apply this in life? I'll give you a great example. In 1918, there was a great pandemic of influenza, and millions of people died throughout the world. It was a terrible thing. This is pre-antibiotic era. And in those days, of course, as we mentioned, the osteopathy was fairly repressed, and they had their own hospitals, and the allopathic hospitals were here, and the osteopathic hospitals were there. The osteopathic hospitals had a lower mortality rate during this time. The consequence of influenza was pneumonia, and since we didn't have antibiotics, you had to treat people differently. And what they attributed this to were the osteopathic techniques. Many of these techniques are now part of mainstream medicine. Lymphatic pump, which is a technique where you compress the chest rhythmically, allows for lymphatic flow. Chest PT, chest percussion, is another technique that's been used for people with pneumonia. Physical therapy, many techniques in physical therapy were osteopathic techniques. In obstetrics, obstetrics is a great example of form and function. My father used to get these consults all the time in the hospital. My father was a great manipulator. He was one of the, probably, he still is, still around. I probably should have called him this morning, tell him I was doing this, but one of the great manipulators. In fact, teachers from the osteopathic schools used to seek him out when they had problems with their backs. Anyway, he would get these consults in his hospital for folks, women that were late in pregnancy having intractable morning sickness. Can't give them standard medications, but by manipulating the spine, he was able to relieve their morning sickness. And that's because of this structure and function relationship. If you can imagine how many women have been pregnant? You've been pregnant? Did you have back pain during your pregnancy? Not much. Back pain? No, well, that's too bad. Morning sickness? Okay, well, never mind. So much for my example. Anyway, what happens as women progress in their pregnancy, they get that backward lean and the spine extends in a different way. The pelvis enlarges because of relaxation. The placenta secretes substances into the bloodstream that causes relaxation of ligaments. And what can end up happening is the structure of the spine and the joints gets out of skew. And consequently, you can develop muscle spasm in certain areas. And the nerves that go to the GI system come down through the spine. And if you have spasm in those areas, that can in turn cause you to have morning sickness. So by relieving the muscle spasm in the spine, you can now relieve morning sickness. My father got a lot of consults to handle morning sickness. It was very effective. Holistic medicine, one of those catchwords of the new millennium, is an osteopathic concept. Wellness is an osteopathic concept. So a lot of what we know from osteopathic medicine is now part of mainstream medicine. A word on Daniel David Palmer. Daniel David Palmer was the founder of chiropractic medicine. He was an interesting guy. He was a contemporary of A.T. Still. And it's possible that they knew each other and shared ideas. There was evidence that they were in the same area of Missouri and Kansas at around the same time. It's just very interesting that both of them came up with similar concepts right at the same time. And I guess the osteopathic folks would say that chiropractic medicine is an offshoot of osteopathic medicine, and maybe the chiropractors would like to believe that they thought of it first. But nevertheless, that's just an interesting juxtaposition in time. Chiropractic medicine takes the idea of manipulation a little bit beyond osteopathic medicine, and Palmer would believe a subluxated vertebrae is the cause of 95% of all diseases, and the other 5% is caused by displaced joints other than those of the vertebral column. That's a fairly bold statement. All right, just a summary, some of the major events in osteopathic history. In 1892, the first College of Osteopathic Medicine opened. In 1894, first class graduated, and the Journal of Osteopathy was founded. In 1897, the AOA was started. In 1898, Associated Colleges of Osteopathy was founded. In 1898, the Philadelphia College of Osteopathic Medicine opened. Just had to plug my school. So it's the second oldest osteopathic institution and the largest osteopathic institution. Last I checked, it was the 7th largest medical school in the United States. The Journal of the American Osteopathic Association came out in 1901. During the 1910 and 1930 era, American osteopathic profession merged more mainstream medical concepts so that by the end of the 1930s, osteopathic physicians weren't just osteopaths, but they were complete physicians. They learned everything that the allopathic students learned as well as their osteopathic techniques. In 1914, A.T. Still suffered a stroke, and in 1917, he passed away at the age of 89. And we talked about the Military Appropriations Act and what happened in California. Where is osteopathy today? There are 4 osteopathic schools that have been around for over 100 years: Chicago, Des Moines, Kirksville, and Philadelphia. American Osteopathic Association now accredits 26 colleges at 32 locations. They graduate 4,000 new graduates each year, 63,000 licensed DOs in the United States today. 1 in 5 medical students are being trained as osteopathic physicians. Historically, 80% of DOs enter primary care specialties, as opposed to allopathic medicine, which is pretty much the opposite of that. Just a note on terminology to better convey to folks about osteopaths and osteopathic physicians. I've been using the term osteopath or osteopathy. Pre-1960, historically, my dad still refers to himself as an osteopath. Just to be sure that people understood, osteopath, the expression osteopath is more slang now. Osteopathic physician is preferred because it conveys that osteopathic physicians are complete physicians. There are training programs in other countries. It's taught in the United Kingdom, Canada, Europe, wherever else. But these colleges are teaching just the osteopathic techniques and not complete medical school programs. And that's uniquely a United States thing. So a DO trained in the United States has the same training as an allopathic counterpart. All right. Well, where is osteopathy going? Good question. Even I go to conferences, the AOA, and everybody sits around scratching their heads, where's this heading? Unfortunately, the way reimbursement is for a lot of physicians, a lot of osteopathic physicians are turning away from a lot of these techniques because they take time. You can't do an osteopathic treatment in 10 minutes. Sometimes it's 30, 40 minutes, an hour, just to do a proper examination and treatment. It's a lot of hands-on. And insurance companies have always had trouble understanding that concept, and they want to reimburse you for physical therapy and things like that. So unfortunately, I fear that in the next generation, a lot of these techniques will be lost, and maybe only in the central, the osteopathic schools will be places where you can go and get your osteopathic manipulation done. So anyway, I hope I've been able to give you some insight on what osteopathy is, where it started, who knows where it's going. Andrew Taylor Still's an interesting guy. If you have some time, want to read about him, he has an autobiography, which is not lengthy, interesting reading. And at this point, I'll just open it up to any questions if you want to.
Thank you. That Osteopathic College of the Pacific that opened up in California, what city was that in?
I think it's it's near San Francisco. The original one was in Los Angeles. Still there, I think.
What about postgraduate training? There used to be plenty of osteopathic residencies when you had lots of osteopathic hospitals, and now that osteopaths are, can gain privileges at allopathic hospitals, how has that changed postgraduate training of osteopaths?
Well, good question. What we're seeing a lot, as you say, is that a lot of DOs are coming out and they're getting accepted into allopathic training programs. And I think that's where the loss of the osteopathic techniques is going to be a problem. I know there are a couple of DOs on family practice here. I know there's one guy I send patients to all the time because he's actually actively doing manipulation in his practice, and it's been a great help. There are programs now that are joint programs, MDDO, which is also a good thing. So you can get either dual accredited, or you can be working alongside your MD counterpart and still get AOA approved training. I think there's controversy about whether a true DO program is equivalent to an MD program. I did all osteopathic training, and I wouldn't trade anything for it. So, but yeah, I think probably the best case scenario going forward is that it would be nice that these programs are dual accredited and meet both MD and DO qualifications, because I think the loss of the osteopathic principles and practices could be a bad thing. I'd love to see this, our hospital here, become a dual program. It opens up a whole nother pool of applicants too for your residency programs. And there's still a lot of osteopathic hospitals out there.
Are there any osteopathic hospitals in North Carolina, and has there ever been a school of osteopathy here?
Fine question. When I came here in 1995, I almost couldn't get a license. I had passed all my national boards, part 1, 2, and 3. I was board certified in internal medicine, and they were all set to refuse me a license. I was flabbergasted because I had jumped through all the hoops, I thought. And it was because they had a rule that my national board's part 2 was 1 year too early. If I had failed it once and taken it the following year and passed it, I would have been okay. But they had all these rules about those things. And the only reason I got a license in North Carolina at that time is because I was board certified in internal medicine, and I had a state license from a state with a composite board, meaning MD-DO together, which was New Jersey. So up until not long ago, North Carolina had some funny rules about osteopathic physicians. Now, having said that, there were only 168 DOs in North Carolina at the time. I'm sure that number has increased by a lot. Campbell University just recently announced that they are starting an osteopathic medical school, and they've selected a dean, and so sometime in the next couple of years you'll see osteopathic school right here in North Carolina. There's an osteopathic school starting in South Carolina. There's an osteopathic school in Virginia. There's Philadelphia College of Osteopathic Medicine has a campus in Georgia. So the South is being infiltrated. But there's still a lot of, what's a DO going on?
Would you say that DOs prescribe antibiotics less than MDs?
Gee, I don't know. I would hope that the hardcore osteopathic physicians who are do manipulation may use that less. I spent a month with my father in his family practice. He's a family practitioner, and he did a lot of manipulation on people that would have been easier for him just to hand a prescription to. And I think the people did better than if you just gave them a pill. Part of the techniques, it's a very humanistic approach, because there's a lot of touch, a lot of, you have to put your hands on somebody, and a lot of physicians have trouble with that. If you can't put your hands on somebody, you just can't do osteopathic manipulation. I promised myself I wouldn't tell too many war stories. I'll just give you one example of how effective this can be. And I remember when I was a fourth-year medical student, we had to do 3 months of urban clinic. We had to do 3 months of clinic. And I chose to do mine at Cambria Street Clinic in North Philadelphia. North Philadelphia being the ghetto was quite interesting. Basically, the clinic was owned by the hospital or medical school, and you were given a booth, and the patients called us booth doctors. And they'd ask, who's your doctor? Booth A or booth B. Every 3 months they got a new doctor, a student doctor. And we got handed a file drawer of patients. Anyway, it was a great experience. Did a lot of interesting things. Saw primary, secondary, and tertiary syphilis all in 3 months. Anyway, this guy came in. He was 40-ish, and he had been. He's on welfare. He's unemployed. Has a family. He's been in pain for 2 years. His pain was leg pain, back pain. 2 years. Couldn't get rid of this pain. Used to work in a casino in Atlantic City. Spent a lot of time on his feet. He was evaluated by all these series of physicians, had all sorts of x-rays, CAT scans, nerve conduction studies, the whole routine. Nobody could find anything wrong with him. They branded him a malingerer. So he comes walking to the clinic out of frustration and just says, "Is there anything you guys can do for me?" Well, I'm a fourth-year medical student. I have a lot of confidence. So I said, "Well, we'll take a look." And I examined him, and he had low back pain. He had pain over his sacroiliac joint, and so I laid him on a table and I measured his legs and looked at his sacroiliac joint, and his one leg was shorter than the other by about 3/4 of an inch, and his ilium was twisted, was tweaked up. A lot of people would say that there's no motion at the sacroiliac joint, and that's false. There is motion at the sacroiliac joint. Anyway, simple examination, one was tweaked up. And I said, "Something not right here." So we went about doing our manipulation. Basically, you loosen up the musculature and you put him in a certain position and you have it all set up, and then you pop it back in. And it's called a high velocity, low amplitude thrusting technique. And when I popped it back in, it made this really loud thwack. In fact, the folks in the next booth heard me, and they're like, "What'd you do?" And the guy got this look on his face, like big wide eyes, and I'm hoping was mostly surprised, but he got this look, and I said, "Are you okay?" He says, "The pain." I said, "What about the pain?" He says, "It's gone." He hadn't been pain-free in 2 years. Pretty dramatic. He sat up. He's like, "It's gone." And we laid him back down, and sure enough, there was no longer that tweaking of the ilium. It was in proper position. His leg was still short, and we ended up putting a heel lift in him. He came back the next month for a little tune-up, and guy's pain went away, went back to work, got off welfare. And it was such a simple thing to see, but you can't x-ray it. You got to feel it. You feel the muscle pain, the tension in his musculature, and you see the simple little tweak, popped it back in, off he went. So much for war stories. Any other questions?
I've got one or a comment. Your form follows function, function follows form thing is what architects are talking about an awful lot today. I believe that's from Frank Lloyd Wright. But I guess whether it's a building or a person, you've still got an architecture.
And, he was a mechanically minded guy, and it makes sense. And if I examine anybody in this room, anybody over the age of 30, I will tell you all have twists and curves and in the wrong place, and your body has compensated for that over the years. I go to the barber, and when he's cutting my hair, he wants to do this, and I want to do this. Right, my head is, you can see my head's a little tilted this way. That's just me. It's been that way forever. But he wants to put my head up so he can cut my hair, and I feel like my head is tilted that way. And you probably all have those little quirks. People stand the wrong way. My favorite example is the young girl with her big heavy handbag hanging off her shoulder doing this and chewing gum on one side, talking on a cell phone, and then later on having the baby on one hip. What's that doing to your posture? What's that doing to your structure? And it's no wonder people end up with scoliosis and chronic pain syndromes.
All right, I've got another question, something that occurred to me. Did the Flexner report have anything at all, any effect at all on osteopathic hospitals and practice?
It was about 1910. The Carnegie Foundation sent out, I think his name was Abraham Flexner, to look at the medical schools of the United States and Canada, the allopathic, or all of them. And as a result, they had standardization of curriculum. And one of the major suggestions was that a medical school ought to be aligned with a university. So, like the medical schools in St. Louis will become whatever it was. Columbia Medical School became aligned with, I believe, Washington University, and examples like that. And I think the ones in Philadelphia, Jefferson, Hahnemann, stood alone because they were pretty well established and passed muster and had laboratory pathology, and were up on pretty much a standard curriculum that was well recognized. But I don't know if it encapsulated the osteopathic
actually,
schools.
a lot of osteopathic colleges are not related to a university. Philadelphia is not a university. It's the Philadelphia College of Osteopathic Medicine. And Kansas City College of Osteopathic Medicine is not a university affiliated. Well, there is Michigan State, Ohio State, Texas, probably several others that are university based. So it's not been a universal adoption of that, good or bad. I'm not sure. I think in that time, osteopathy was obviously struggling for recognition, and they were trying their best to do everything right, which is why during the 1910 to 1930 era, there was they wanted to make sure they were incorporating mainstream medicine into their teaching as well, not just the manipulative medicine. So I think they came out of the 30s with more of a well-rounded approach to medicine.
Yeah, one of the things the Flexner report did was to reduce the number of medical schools as a result of the lack of scientific training, because Flexner and many other people at the time recognized that. And that really did downsize and make people affiliate with the universities. I have a personal note from the point of view of osteopathic medicine. I've been on a number of site visits to medical schools, but also to College of Osteopathic Medicine. One, I'm a native Philadelphian, and so I know Philadelphia College of Osteopathic Medicine. I'll never forget visiting there, and the statement was made by the dean that the third and fourth year students were much sought after by the medical schools in Philadelphia, specifically mine, University of Pennsylvania. And so we asked for the data. And it turned out that in rotations in the third and fourth year, the physicians really wanted to have at Penn and at Jefferson and Temple and the other schools a good representation, because the trainees were extremely good physicians in dealing with the patients and interacting and moving the whole agenda forward. And I sort of got that when I visited LACOM, Lake Erie. Mm-hmm. They have two schools, one up in Lake Erie and one down in Bradenton, Florida, about 220 in each class. Why didn't Erie develop a medical school? Well, one of the reasons is that they felt the osteopaths were so much better trained than the allopathic that they didn't want to move in that direction, and it's all part of the history. So I think this collaboration and working together is important, and I think we learn by different ways of getting to the same.
One of the good things about training in Philadelphia was that while a lot of our hospitals were smaller community-based hospitals, you had the opportunity to go to other institutions and see, you could go to Penn and do an elective rotation there. You could go to, I went to Lankenau and spent a month there. So there was a lot of, and I think in Philadelphia with so many medical schools, it kind of drove the quality. But one of the things we saw when we finished when we were in the middle of our internship, we were highly sought after by allopathic programs for residency. I think mostly because we were going to have to repeat our internship another year because of the way the licensing was. But when you come out of an osteopathic rotating internship, you could do a lot of stuff. A lot of stuff, because it's a rotating thing. We did surgery, did OB, did pediatrics. It wasn't just medicine or surgery or anesthesia or whatever. So we were really sought after, and I just elected not to go down that road.
Anybody else? If not, let's give Dr. Wagner a round of applause. Thank you very much.